Welcome back to Afternoon Express. Today we chat to Dr Kerrin Begg, public health medicine specialist from UCT's Faculty of Health Sciences. She gives us an important update on the number of people infected by COVID-19 in SA and worldwide. We also find out where we are in terms of finding out a COVID-19 vaccine that works. Welcome to the Loft, Doctor.
Thank you very much, and thank you for having me.
This conversation is very topical right now. As soon as you turn on the radio, when you switch on the television, everyone is asking, where are we standing? Are we still in good stead, or is it time to, start paying attention again? So where are we standing in terms of South Africa and worldwide when it comes to numbers of infected, positive COVID-19 cases?
So worldwide, we're sitting with 60 million cases. That is more than the population of South Africa. So let's just think that, the entire population of South Africa is infected equivalently in the world. In South Africa, we're sitting with 772,000. So that's close to 1 million. But when we think about it, we've got 21,000 recorded deaths, but actually closer to 50,000 excess deaths. So if we work on about 1%, we probably have closer to around 5 million cases because of all of the aspects around asymptomatic cases and those undiagnosed. So we have a lot. I think that in terms of getting chilled about COVID and kind of thinking it's all over, we really need to wake up because cases are significantly ramping up again. We're starting to see clusters, and particularly in the Eastern Cape, we're starting to see hospitals overwhelmed.
Absolutely.
So when we see hospitalizations increasing, cases increasing, deaths increasing, we really need to make sure that we're all doing our part to protect the population, to protect everybody.
Absolutely. Now, the very next question a lot of people are asking is the question around vaccines. Now, we do hear that overseas there have been vaccines that have been released, and there's, lots of ums and ahs, because as we know, vaccines do take years to prove, to work through. People have antibodies, finding ways around that. So where do we stand here in South Africa when it comes to the vaccines and just protecting ourselves medically?
So one of the immense benefits of COVID is that because it's a pandemic worldwide and because we are a lot further along than the flu pandemic of 1918, is that the technology is there now for vaccine development. But it's also worldwide, which means that actually most countries are part of a collaborative. So this is something really exciting, that we see the world working together for a vaccine. So worldwide, we have many vaccine projects and trials happening, but we really have seen some really great results from 3 different vaccines at the moment. And people would have heard those as Moderna, Pfizer, and the Oxford vaccine trial. And so those are all looking really good. The reason that they're happening a little faster than perhaps people would have been noticing is because financially the vaccination development companies are not having to wait for long periods to decide whether it's going to be competitive and value for money, because actually there's a demand, there's a massive demand. And so, but at the same time, we can reassure the public that all measures are taken for safety. So every single vaccine has to go through 3 sets of trials. The first is for safety. So that's the first thing that happens for any vaccine. The second thing is around dose, to find the most appropriate dose that gives the results. And the third is around efficacy. Does it work?
Okay. So, Doctor, something that we do know works, vaccines or not, is just using a mask. I mean, we have seen a huge decline in the droplet infection rates going about. And you're also part of a very incredible initiative called the Buntu Care Initiative. So tell us all about these amazing masks.
Thank you. And I think that that's something that's really important, is that our non-pharmaceutical interventions and behavioural measures can do a lot in terms of preventing.
Yes.
So wearing a mask means that I stop my droplets from infecting you. And we're at a social distance, so we don't have to worry about masks right now. But in general, the important thing about a mask is that it must cover your nose to under your chin.
Yes.
So when you're wearing it, it really needs to be worn properly, because you're about not being able to prevent the transmission. And the important thing about a mask is that my mask protects you and your mask protects me. So it's not about me protecting myself, it's about thinking that I'm positive and then making sure that I don't transmit it to anybody else.
Absolutely.
Washing hands, keeping your distance, staying at home when you're unwell, those are all really, really important. So I've brought you a gift, which we'll sanitize and give to you later. It has instructions about how properly to use the Ubuntu Care mask.
Oh, wow.
It's a little pack of 2. Now, the important thing about Ubuntu Care is that it's both an employment-generating opportunity for a number of women and seamstresses in underprivileged areas who haven't previously had work. For every 2 that are purchased by the private sector or by anybody like you and I, there is a free mask then donated to those people who can't actually afford to buy their own masks.
Thank you so much, Doctor. I really appreciate not only this initiative, but just continuously spreading the updates and the information and the education around COVID-19. We really do appreciate it. South Africa, head over to our website to get more information on the Ubuntu Care masks.